So first, gonna work dry, get my hands nice and warm. And Ray doesn't have any significant issues that we're aware of anyway, so keep that in mind. So a lot of people, what they're trained to do, and this is fine, however, over the years of doing this once or twice, I find there are gentler and more effective ways to go about it. Okay, so a lot of people are taught this thing. I don't love that. Also to dig into the SCM this way, which can be okay, but it is an area with a lot of sympathetic nerve ganglion. Sympathetic means triggers reflexive fight or flight response. So a lot of people that have had injuries in this area are really protective of their neck, rightfully so. So if you ever notice you're working with somebody's neck and it seems that they're tensing up, and you have to keep reminding them to relax. First of all, you're in a wrestling match with them at that point. Secondly, I find sessions hold a lot longer when you get them in a place where their neck just wants to relax, and I don't have to tell them and constantly keep reminding them. So a few ways to approach people with reactive necks like that. So I'll show from this way. And Ray, if you kind of bring your head up a little bit so your SCM pops up, boom, you can see it right there. Okay, nice one. All right, there is work that can be done anteriorly in some more complicated cases. We're not going to do that, and most of the time it's unnecessary. I would say it's unnecessary a good 85% of the time. Okay, unless somebody has people that use their throat a lot, opera singers, people that talk a lot, litigators, people with TMJ dysfunction, speech issues, that's where that might come in handy. Otherwise, there's not generally a reason to go there. So a good way to, stay safe, as I would like to call it, stay gentle, as you follow the attachment. So you don't even have to have somebody bring their neck up that way. If you put your hand right just at that medial aspect of the clavicle, boom, have your thumb land right there. Now keep in mind this is an endangerment site, so you don't want to put your thumb here. Really gently. So find where the clavicle kind of meets the sternum. There's a little notch there, and just let your thumb hang out there. Okay, depending on the size of your hand, okay, so here my thumb is here. Depending on the size of your hand, some of you with bigger hands, your hands will come the whole length. You just want to angle your thumb to their mastoid process, pretty much behind their ear. My hand is quite small, so my wrist is going to land at his mastoid process. That's okay. Or the base of the occiput, right? You don't want to go into the mastoid process. It can be delicate, but that's a landmark for where to have either the heel of your hand rest, your wrist, wherever that naturally falls. But your thumb is just hanging out right there. You're not digging into it, so you'll feel the tendons, kind of like guitar strings there. You're not going to dig into it. And all you're going to do, right, and this hand is just going to fall gently there. So you're just kind of cupping it, right? You don't have to hyperextend. So if your hand's like this, that can put strain on that saddle joint. Not a great idea long term. But if you're sitting, if you're standing, angle your body this way, down on the floor, comfortable. So your hand is relaxed. So you shouldn't have a stiff hand. So I'm going to check in with Ray here. So Ray, here's my hand. I'm going to add notable difference. And I didn't even grip that hard. Okay, it's not that it feels bad. This is just we're starting from a place where their neck is not going to feel any tension in your hand and then react in kind. Okay, because that can happen, especially people with protective necks if they've just had a whiplash injury and things like that. Now notice how I'm using my arm here. Remember, this is however large your hand is, this is where this hangs out. and I'm just turning his head into my hand for starters, right? So I'm using this hand to guide. I'm not like mushing him around. I'm just turning my hand into here. Okay, and I'll show that. I'll flip it so you can see what I'm doing with the other hand. Just like that. So what's happening here is the lateral part of my thumb is resting on that posterior aspect of the SCM. And it's kind of, to exaggerate what's going on, it's kind of just pushing it a little this way. Okay, those of you familiar with DNM, this follows some of those frameworks. It's not full DNM, it's not all skin glide, okay? So there's lots of ways of doing DNM, but the concept is there that we're just thinking about the skin. So here I am actively moving my hand, okay? Now, I'm not moving my hand into his neck, I'm dragging it towards that base of the occiput here. This hand, sometimes the weight of his head is enough. So here he is with his head turned away from that. Okay, and I'm just kind of, when you get the right skin stretch, also there's no oil applied yet. We'll do it with oil in a little bit. So I'm just bringing it back this way. Okay, the skin's gonna stop dragging there, boom. Easy so far? Okay, this hand, really gentle. You don't want to use a forceful hand. People can detect that instantly. It feels like you're being mushed. Nobody wants that. So I'm just going to kindly, you'll see the reverse of it. Hold around his ear. You don't want to smush his ear, and I'm just going to bring the head this way. Okay? So there's an element of traction going on too, and then I'm going to turn his head into my hand, and it's going to lift up onto my forearm. And the pressure that's coming into the SCM is not force, but it's deeper than you might think. Okay, I can make it a little deeper. I'll just mirror what I'm doing with my hand just by pulling away from it. So I never have to push into it. And that's where that reaction can come from people. Okay, so far? Okay, boom. Now I'm going to just mirror that so you can see what I'm doing with the other hand. This hand is going to mimic that hand so you can see what that one's doing. His head is here. I am holding here or here, depending on how big your hand is. And I'm holding back this way, and his head's just turning into my hand here. You can also turn it so I'm not so much working with this SCM. We'll get to that next. And I'm using my forearm just to kind of base there. Nice and easy. You can do really slow holds. So this is really slow work. Now you can add two hands. So you can turn the head lightly this way. And then this hand, you'll see what I'm doing with the heel of my hand. Some of you may have bigger or smaller hands. You can make it work with any part of this. Just remember, this anchor stays in this area. So this is tractioning the head back. And when the head tractions back a little bit, it's going to create a really comfortable pressure there that feels very different than driving a thumb in here and doing this. Yes or no? Any feedback, Ray, so far?
Yeah, it feels smooth. It's good.
Okay.
Yeah.
So other ways of approaching this. Next, before we get the oil on. So if even that somebody's having a reaction to, what you can do is I'm going to use the same position, and starting here, here's my thumb. Remember, we're going to stay on the posterior aspect of the SCM, not going into the anterior aspect. What I'm going to do with Ray, so Ray, go ahead and turn your head into my hand. Boom. Okay. And get your ear. Pop his head. So I'm going to pop his head on my forearm a little bit more, support his head here, and I'll tell him you can use my forearm like a little kickstand, and it's going to, and you hold that there. as long as you like, and then come towards me. And I'm just going to catch his head this way. So in essence, he gets to control the depth of pressure from his own movement. Okay, so once passive, and this is active, so you go ahead and go again. Okay. And after about 3 of those, take another step. Boom. And notch up. Move up about another inch, or what is that in centimeters? Like 2 centimeters?
Mm-hmm. Yeah.
And you can help his head along, and you just guide it back on the way down. So your forearm is also a bit of a ramp to get that flexion motion that's comfortable, and you're supporting them along the way. Nice and slow. You do about 3, 1, 2, 3, 1, 2, 3. And so when you get to this part of it, be careful here, right, in that dip where the styloid process is. That can be really, really, really sensitive in people. So adjust, so you're always staying posterior to the SCM. And by the time you get up here, you're going to be at it. You don't want to be at the mastoid. You don't ever want pressure going directly in the mastoid, but right somewhere between like the mastoid and the occiput. Now, if that's uncomfortable on your thumb, you can also use this hand. I'll show you here, because this hand's going to be here. You can also use this hand, which is a bit of a different feeling, and his hand is going to turn in, and as he turns this way, I'm just guiding it up gently. Boom. Okay? And you have him do that a few times. And you repeat on the other side. Oh, you had a nice little click there. Right? So when somebody's relaxed, and the intent, of course, we're massage therapists, we don't try to crack joints at all. But what I've noticed with the neck, when you don't have to. So I'm also, for me anyways, not a big fan of chiropractic neck manipulations like that, just from past injuries. But many times when somebody's turning their own head and they're relaxed enough and not holding on to any tension, stuff just sorts itself out. And it's really nice. And especially when they're guiding the movement. So difference between them doing the movement, and us doing the movement is one of them is passive. So we get sensory receptors in the skin, some of the proprioceptors in those joints. However, once you have them do the movement, you're engaging a different set of neurons, which are the motor neurons. Okay? This is great. You know, passive massage is great, but at some point it's going to hit a wall. So if you find somebody's neck is not responding to this, more of it is not going to make it relax. I've never known that to be the case. You can't fight with somebody's neck. He's already snoring. What you may need to do, so the issue might be in the motor neuron. So you're not talking to the right nerve here. You have to wake something else up. So this is a good thing to try next. And I notice when a neck gets those really stubborn areas, it's probably not the right nerve fiber or the only nerve fiber involved for that reason. So in addition to the sensory neurons that you can calm down and make happy, you actually have to get that motor neuron to untangle itself through movement. And what I found is nothing beats the patient or client finding their own movement. So just tell them, do what feels good to you, right? Only go as deep as you want to go, and they will. And if you find them coming into it a little bit more, like they want a little bit more pressure, you can dance with that a bit. Okay. And I'll show you what that looks like with lubricant, and then Ray will be fully ready for his nap. Okay, even when I apply oil, I want it to be nice. So my intent behind that is I'm not just putting oil on. Also, especially my first time working with somebody, and I do very specific cases, so it's not uncommon that I'll spend full time working here with somebody on a specific problem, and that's not just for relaxation. Although, of course, yes, we also want them to be relaxed, because firm believer, relaxation is the best medicine. So even when I'm applying oil, I'm getting a read on how they're reacting. So if I do this and they tense up, or that could be for many reasons, I want to take note of that. Okay, so for the first minute or two, I'm getting a feel for their tissues. A lot of you know this already, but now you know I'm coming at it differently. It's not just effleurage technique, right? I'm almost like wisping the oil on. And that's how and then I start coming in a bit more. And then what I showed you from the beginning, that gentle C-hold to find the SCM is going to look like this. I'm coming in this way, sliding in. If your hand gets stuck, don't worry about it. That's okay. You can brace their head here, smooth the sheet, and gently come there. Boom. Anchor it. Find that. Rest here. And then I'm going to start turning. Now I'm adding a little bit more, but I'm staying on that posterior aspect of the SCM. Well, here I am trying to strip right away that SCM, and that's where a lot of those sympathetic nerve ganglion are, where that can make people reactive. Okay, so here I'm coming this way, and sure, you might want to work in this direction, but notice I'm staying posterior to the SCM, and that movement with my head, I'm not pushing in this way. My thumb is staying steady, and I'm just I'm going to exaggerate the movement doing this. Okay, and notice how I'm moving and really slow and smooth. And I just want to, as I come here, I lighten up pressure a lot. I've seen people dig in here. Not much use for that. Okay, and there's a lot of people with reactive necks. Okay, coming here, and I use this because it feels nicer. Supportive hand, come into that gentle C grasp and glide up this way. And I'll show you that so you can see what it would look like on the opposite side. So this is going to be here. This is now going to be the hand that's moving, coming in this way. And this hand is working too, so it can definitely work in posterior cervical. So as I'm doing this here, head's coming in there. Boom. Be mindful you don't want to squish somebody's ear. It can be. And you can see here. There's people with different sized necks, so of course adapt. For body mechanics, I'm very comfortable. I'm just leaning on a table like this. I can stay here all day, and here are my hands, and I'm just doing that. Okay. And I'm also exerting very little. Minimal force, right? So that can look big or small, and it can be glidey. You can do it dry. Here, the finger can cover quite a bit of ground. This hand can do other things, and this finger can work on this side also. Okay, so you have same side ipsilateral treatment, or you can approach the posterior SCM here. Okay, and being mindful, of course, of people with herniations and things like that. Yeah, but those are some options for working with the SCM that I find most people respond to, they like. And then, of course, you can do your other things. And we'll finish off with some nice here. And if you wanted to move into this side, right, just to even it out, so you can turn your head there, only if you want. Boom. I think he's out, y'all. But that's the idea. The more relaxed they are, the better and longer the treatment's going to hold. So if you have them in a place where they're the slightest bit tense, you're fighting with their nervous system, and their nervous system's always going to win. Okay. And in a lot of those cases where people, I know lots of people report they were feeling sore the next day, chances are very low that this is going to make them sore the next day. There's no reason for somebody to have a sore neck, and something got aggravated. I've made that mistake before, but it can be avoided, and this is a really good way to bypass that. Well, I hope that was helpful. Thank you, Ray.
Oh, thank you.
I'll hook you up a little more before you go. That's what you want. Relaxation is the best medicine. Okay.